So this is all about self-care, so the pyramid of services for mental health. And we're just having a sort of think about where self-care fits in all of this. So I'll just talk you through this diagram. So on the left, we have an arrow, the frequency of use. So the ones down the bottom here are used very frequently. The ones at the top, less frequently. So we go from sort of self-care, informal community care, and sort of groups in society. Then we've got our sort of formal services. So in the UK, we've got the NHS, so primary mental care services. There's then this next level. So it could be psychiatric services in a general hospital or community mental health services. So at the moment, there's really sort of a push towards the community model of mental health services, keeping people in a space which is sort of familiar and safe to them rather than a hospital, which can be quite a stressful, disorientating environment. So there's actually, I can share a post up at the moment looking at sort of facilitating the move from hospital into sort of community mental health service. At the top, we've got our long stay facilities and specialist psychiatric services. So less used, but very important sort of if people do need that sort of level of care. So it's a whole sort of, spectrum there. Going down, we've got the costs. So obviously the long stay facilities and specialist psychiatric services are quite expensive. Whereas if we go down to sort of the self-care, informal community care, it can be just sort of, a membership model for a yoga class perhaps, or even some exercises you can do at home without needing, to buy into anything. There's a lot of resources on the internet and things, and providers often have sort of a level of service that you can access on your own, or you can learn techniques which you can then implement in your sort of home environment there. So for the purpose of this webinar, we're going to be looking at these bottom two, mostly informal service, so community care models and self-care. But also noticing that self-care, it doesn't stop at this level. So if you are in a primary mental care health service, you need to do self-care as well. Same with sort of community mental service and psychiatric hospitals. There might be facilitated ways to do self-care. So there might be, say, occupational therapy and art classes in a psychiatric hospital, or sort of support groups and football groups, perhaps. Sports groups are quite a good sort of model of providing that sort of space for self-care within that community mental health setting, as well as on a sort of more informal community level, which we'd say more sort of well-being rather than sort of anything beyond that really. So these two things are the sort of focus of this webinar. So signposting, I just wanted to sort of quickly display this sign. So sometimes it's really important to recognize that you may need more than just self-care. So if you're in a mental health crisis, if someone you're worried that they are having sort of suicidal thoughts or thoughts of self-harming, these are things which would need crisis support. So in some circumstances, that's a 999 call if you're worried about that person hurting themselves or others. And there are actually other sort of places you can go. So we've got some examples here. Papyrus has a hope line. So anyone who themselves is struggling with suicidal thoughts can actually call that number and speak to someone, getting that sort of help straight away there. The campaign against living miserably, they've identified, I think, 75% of sort of young suicides are male. So, they have specific support for that sort of group as well, and a web chat service. I know we've got a few people from the university on the call today. So Nightline is the student support line. So they can give nighttime listening services to students. And other sort of specific providers. So Switchboard for LGBTQ plus people identifying in that sort of category. So these are just six. There's hundreds of different organizations out there. I find that lots of people who've been through a traumatic experience, they kind of want to sort of signpost the way for people having that same sort of traumatic recovery journey as themselves. So just letting people know they're not alone. You're never alone. There's always someone else who's had a very, very similar experience. And quite often, people do come out the other side. So even if your brain's telling you there's no hope, I don't believe it, because things do change, and there is help out there. So yeah, don't be afraid to, if you feel that you need to call one of these numbers yourself, or you think someone else could benefit from that sort of signpost, then it is great if you can provide that sort of direction to people who are experts in sort of mental health recovery.